Yeah, and that's really the driver behind all of the standardization work that I'm going to talk about is what's going on at the FCC. So the FCC is considering allocating 40 megahertz of band for medical body area networks. And there's a task group at IEEE similar to the task group that Art is chairing, which is on body area networks, but this is focused on medical body area networks, so it has a much more narrow scope. And I'll get into that in a few slides. Just in way of background, so this all started in December of 2007 when GE Healthcare petitioned the FCC to use 2.36 to 2.4 gigahertz for medical BAN. They proposed it be used only for medical applications and on a secondary basis. So what that means is the users for the medical applications will have to defer to the primary users. Who are the primary users? Well, in various parts in that 40 megahertz, it's aeronautical mobile telemetry and telecommand, radio astronomy, and amateur. And so what is AMT, which I'll shorten aeronautical mobile telemetry and telecommand to? These are mostly airplane manufacturers and people who make aeronautical systems, and they use this band for testing of those airplanes and those aeronautical systems. That sounds like it's a pretty big restriction on the use for medical applications. It turns out it's not. You tend to test airplanes in remote areas away from people for obvious reasons. And most hospitals and medical facilities are located in population areas. So there isn't a lot of overlap between the locations of these potential usages. In May 2008, the FCC issued a notice of inquiry, basically asking the public what they thought of this idea. And in June of 2009, the FCC published a notice of proposed rulemaking, or an NPRM. This is an indication that the FCC is more seriously considering doing this. In October and November of 2009, they received comments and reply comments. And they received 19 sets of comments and reply comments, but the most significant comments, the most comprehensive, were from 4 groups, from GE Healthcare, Philips Healthcare, a group called AFTRAC, and Boeing. GE Healthcare and Philips, it won't be shocking, both were very supportive of this potential use of this band. AFTRAC is an industry organization that represents the AMT users. And Boeing also is an AMT user, and they both expressed concerns about using their band that they're using now on a secondary basis. And the primary concern was over coexistence issues and interference. Again, not surprising. It's a good question for them to ask. So where are we right now? At the FCC, the current stage is that any interested party can submit ex partes to the government giving more information. Actually, in January of this year, a significant development happened, and that's AFTRAC, Philips, and GE proposed service rules jointly to the FCC. This is somewhat unusual and a very positive step. What this means is the 2 biggest proponents of the secondary use and the biggest person who's questioning the secondary use came together and said that they agreed that this would be a potential good use and put rules together and actually submitted them to the FCC. And if you're interested in more details, the entire presentation of these proposed service rules can be found on the FCC's website, and the docket number is 08-59. And if you do a search there, you'll find a large amount of information about this. The next stage at the FCC, assuming they decide to go forward, and since there's no longer any major opposition to this, is a good likelihood that they'll go forward with this, is that the FCC would issue a decision and put out proposed rules for comment. And if that were to happen, the currently expected time frame for that would be in the early fall of this year. Okay, so I've talked a little bit about the MBAN proposal. What exactly is being proposed? Well, as I mentioned, it's a proposal for secondary use for medical applications, specifically for monitoring, diagnosing, and treating of patients. It would be something called licensed by rule and only by authorized healthcare professionals. This means that these are not going to be devices that you would go to the store and purchase. They would have to be issued via a prescription or issued to you in a hospital. And the discussion is to divide this 40 megahertz up into 2 parts. The lower 30 megahertz would be limited to use only in healthcare facilities. And actually even more limited than that, only indoor use of healthcare facilities. Why? Well, if you look on the bottom of this chart, you'll see that that lower 30 megahertz is where the AMT users operate. And they're worried about interference. So by keeping these devices indoors, which are intended for very short transmission distances, the primary users can be more completely protected. The upper 10 megahertz, the proposal is to permit operation anywhere. And for the lower 30 megahertz, the plan is to have a coordinator who will actually manage the usage of the band. So anybody who's going to use the band in the lower 30 megahertz will have to register. And so really there's sort of three cases for this lower 30 megahertz. If the healthcare facility where the devices will operate has no radio line of sight to an AMT location, so a place where these aircraft are tested, then they can freely use the band. If there actually is radio line of sight to an AMT facility, then some further testing will be needed to make sure that the primary users won't be interfered with. If the testing comes out positive, then again, the healthcare facility will be able to use the band, the lower 30 megahertz of the band. Even in the case where they determine that there could be interference with the primary users, there's still an opportunity to use the band. The primary users tend not to use the entire 30 megahertz, so a subset through the coordinator could be allocated, which they could use. And also, even in the parts of the band where the AMT user could use it, they don't use it all the time. Airplane testing doesn't happen continuously, so there'll be plenty of times where the band could be used by healthcare facilities when it's not being used by the primary user. So where does standardization fit into all of this? Well, technical solutions are going to be needed to implement the FCC rules once they're issued. And in Philips and others, when looking at this, realized that in IEEE there's an existing standard called 802.15.4 that's a good technical fit, but it's going to need to be modified to operate in this actual band. So what's been happening at IEEE? In March 2010, Philips proposed the creation of a study group. This is how IEEE decides whether or not they want to actually write a standard in an area. They study the problem and see if it makes sense. In September of 2010, the study group submitted a request to IEEE asking to become a task group. And IEEE, a task group, is the organization that actually writes specifications. So the study group agreed that it was a good idea and asked IEEE to approve its creation. And in December 2010, it was approved and came into being. And in January, the group had its first meeting and issued a call for applications, asking people how they thought the band should be used. And what the group did is it has a very narrow scope. So the task group was created with the scope as written here, which is just to define an amendment to an existing standard, 802.15.4, to use this new band, and it's required to change it only in ways to make it comply with the FCC MBAN rules. So as you can see, very narrow scope. So no real new features are to be added here. Just move the band, move 15.4 into this new band, and to enable it to comply with the FCC's rules, and also any modifications to the MAC that are needed to do this. The group is not nearly as far along as 15.6 is. So what's happened this year is that we've issued a call for proposals in March. In May, we received 3 preliminary proposals, one from my company, Philips, one from Samsung and LG. And the plan is in July, and the upcoming meeting in San Francisco, we'll hear final proposals and begin discussions of acceptance and merges of the proposals, which hopefully will happen a little quicker than in TG6. And the expectation is that it does. Since the scope is so much narrower than 15.6 and we've only have 3 preliminary proposals, the expectation is that we can make pretty good progress. And the plan is for completion of this standard in the summer of 2012. Okay, that's all I have. Thank you.